Honourable Annette King.
My question is to the Minister of Health. Do all DHBs have sufficient resources to provide safe, quality health services?
Honourable Tony Ryle.
Mr Speaker, yes, my objective is that all patients receive high-quality care. And this is helped by having over 2,500 more nurses employed by DHBs across the country under our government. As the member knows, from time to time, as we've seen in the Hutt Valley story in today's Dominion Post, during the winter season of heavy demand and staff illnesses, there are periods of extra pressure on staff.
Supplementary question, Mr. Speaker.
Supplementary question, Honourable Annette King.
In light of that answer, Mr. Speaker, has he seen the press release a few moments ago from NZNO stating the practice of, quote, care rationing to patients is widespread as DHBs and nursing teams, quote, are forced to do more with fewer staff and less money, and fiscal constraints are creating a, quote, a head-in-the-sand approach to staffing issues in our hospital, end quote. If so, when will he get his head out of the sand, or wherever it is, and listen to our valuable health professionals?
Honourable Tony Ryle.
Mr Speaker, I haven't seen that press release from the Nurses Union, but what I do know is that in the term of this government, there are now 2,500 extra nurses working in our district health boards, together with extra funding averaging $500 million a year.
Supplementary question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
Has he been informed that acute mental health community services over all five localities at Waitemata DHB are required to reduce their expenditure by $1 million this year, with 16 positions to be lost because of budget constraints? If so, what impact will these cuts have on patients?
Honourable Tony Ryle.
Mr Speaker, I am aware that the Waitemata DHB is looking at how they can best arrange their services in that community, and that's the reason why this government gave them an extra $31 million in this year's budget, a total of $226 million extra for the Waitemata DHB over the last 5 years.
Supplementary question, Mr Speaker. Well, in light of that
supplementary question, Honourable Annette King.
Has he been told that the acute response in forensic mental health services at Waitemata DHB is required to save $250,000 this year, that the staffing at the adult inpatient units is to be reviewed to save $305,000 this year? If so, what impact will these cuts have on patients?
Honourable Tony Ryle.
Mr Speaker, I don't have the exact details of those changes, but what I do know is this year we've given the Waitemata DHB an extra $31 million, and in the last 5 years they have employed 143 extra doctors and 302 extra nurses onto the front line of healthcare on the North Shore and West Auckland.
A supplementary question, Mr.
Supplementary question, the Honourable Annette King.
Has he been told, in light of that answer, has he been told that community alcohol and drug staffing at Waitemata DHB is to be reduced to save $436,000 this year, and an NGO provider is to have their contract reduced by $232,000 this year? If so, what impact will this have on patients?
Honourable Tony Ryle.
Mr Speaker, because we're giving the Waitemata DHB an extra $31 million this year, I am fully expecting that services will improve in those areas, because this government is focused on delivering more care for patients, and that's one of the reasons why we have over 300 extra nurses at the Waitemata DHB and 143 extra doctors, and patients no longer wait 3 days on hospital trolleys and corridors under bright fluorescent lights in the emergency department.
Oh dear, oh dear.
Supplementary question, Honourable Annette King.
Has he been told administration support for mental health services at Waitemata DHB is to be cut by 25% to save $1.19 million, and budgeted sick leave is to be reduced from 10 days to 7 days to save $260,000, and do all these cuts measure up to his promise of better mental health services for people in Waitemata?
Honourable Tony Ryle.
I've never had an opposition MP talk about cuts to administration and be opposed to them before. We are right behind any reductions in administrative staff and have the money put into better services for patients with the extra $226 million that we've put into Waitemata, providing more services for patients.
Question number 4, Simon O'Connor.
Thank you, Mr. Speaker.